大家好，我是 Amanda，今天继续和大家更新我和 Sophie 一起办的 Case Workshop。上一期视频里面我们讲了 Case 的前半部分，也就是 Recap、Clarification Question 和 Framework。上期视频的最后我们讲到了要看 Framework 中的 Revenue，所以说接下来的这个问题就是会详细的算一下这个产品的 Revenue。So this is how I approach the market sizing from the bottom-up approach.It's all based on one equation. The revenue equals the price per patient multiplied by the number of patients, so that we can break it down into two buckets here. The first is the price per patient. We can further break it down into those, but just like Sophie mentioned, we already know that it's $8,000 per patient. And then we can move on to the second bucket, which is the number of the patient. So from the clarification question, we know the total number of patients to be 260 cases per year. So that's a known information. Then we have to know how many percentage of the patient will actually get treated, because we know a lot of people just live far away or they don't know they get a stroke, so they will never get treated. And then among those patients, I further divide into two factors to consider. First is the part of the patient who can treat it in 3 hours, because just like you mentioned in the prompt or in the clarification question that our product and our competitor's product is only effective in the first 3 hours of the stroke. So we should only consider those patients who can get treated in the first 3 hours. And also, like I mentioned before, there's competitors. So we also need to consider if the patient is going to choose our product or the competitor's product. Yeah, so that's how I'm going to calculate that. Then do we have more information on like the timing and the percentage of the patient who are going to use our product?
Okay, sounds good. So here I will share an exhibit with you. So that is the distribution of the patients in terms of their geographic location and their ways for calling for help.
Okay, thanks for the exhibit. Let me just take a moment to read it.
Okay, so here I'll give everyone 1 to 2 minutes to read the exhibit and digest the information, and let's see whether you can see some insights or how we're going to calculate the revenue from this exhibit. Okay, so Anna asked what percentage of effectiveness of our drug compared to our competitor in the first hour. Yeah, I think, yeah, that's a very STEM style question. So I don't have a number. We just know that it significantly improved the life. So given that it's significant, so people don't want to lose their life, right? They always want to go with a better drug. So let's assume the first hour is significant.
Yeah, and then for the ease of calculation, I will just put 100%.
Yeah, that makes sense because people will try the better method to save their life.
Yeah. Okay, so I saw there is a term that I'm not familiar with. So what is automatic trigger? Sounds like the helicopter service in LA for the super rich people. Is that right?
Yeah, that's correct. It means a helicopter.
Okay, sounds good. Okay, I think I read the exhibit and then I have two major insights. The first one is that based on this exhibit, we can further segment the patient population based on the way they get the service, like automatic trigger versus call regular ambulance. And then if we further look at the number, we can see like by automatic trigger, the patient can get to the hospital really quickly, and all of them will get to the hospital in the first 3 hours. But for the ambulance, it will be a ratio of people who can't get to the hospital in the first 3 hours. And even though they can get into the hospital in the first 3 hours, it may not be in the first hour, which is really crucial for our product. And the second insight is actually from here that we can further segment the patient population based on the geographic distribution. Because just using our common sense, if you just live really far away from the hospital, it will take a longer time for you to transfer to the hospital, so that we can do, or we can look further into that part of segmentation so we can get a better estimation of the total revenue.
Sounds good.
Yeah, so with that, I wanted to revise my structure and proceed with the calculation. So I want to work on the number of patients. So I put a question mark on the total here. So like I mentioned before, we had the total number of patients, and then we wanted to know the patient who get treated. And then based on this exhibit, I'm gonna go further segmentation. So it is shown here that I divided the patient who treated into two segments, automatic trigger and call ambulance. I'm going to look at the automatic trigger first. We see in exhibit that 20% of those patients are getting an automatic trigger, and from them, 100% of them will get to the hospital in the first 3 hours. So I put 100% in this bucket here. And then we see time it takes for patients to reach the hospital is only 30 minutes. That really fell into the 1 hour window. So we can assume that they are very likely to use our product. And for the calculation, I just put 100% here so that we can conclude this branch actually. So that for automatic trigger, we can calculate using the total number of patients multiplied by the percentage it received the service, which is 20%, times 100% of them get to the hospital in the first 3 hours, times 100% of who gonna reach there in the first hour and use our product. So we concluded on this branch. Then we can go into the next one, which is to call regular ambulance. And then we still have to do this kind of segmentation. So the patient treated in the first 3 hours is 60%, which is in exhibit. And then the patient who choose our product need further segmentation. And based on the second table in the exhibit, I would further divide it into the city and suburb. But in this exhibit, we only know the percentage of patients fall into that category. So do we have more information on like the time they will arrive at hospital?
Okay, so for patients living in the city, it takes 8 minutes for an ambulance to dispatch, usually, and 10 minutes to load a patient. So that those are the time required. And for the commute, it takes 12 minutes one way for an ambulance to commute, go to the city from a hospital.
I see.
But for suburbs, besides these minutes, an extra 8 minutes one way to go from suburb to the hospital.
So it's actually 20 minutes one way. And then when we calculate the time, so you're saying one way, so the ambulance had to drive from the hospital to the patient's home and then have to drive back. So we have to double the time, right?
Yeah.
And then, okay, so my way to calculate the total time is to first plot the sum of the 8 minutes and 10 minutes because they're already there. And then plus the for city is 12 minutes one way. So 12 multiplied by 2 and then add them together and then just do a quick calculation. It is 42 minutes. And then for the suburb patients, most part are the same except that it's 20 minutes one way. So after we do a quick calculation, it's actually 58 minutes. Yeah. So based on my calculation here, for the patient in the city, it just takes them 42 minutes to go to the hospital, which fall within the 1 hour window. So it's very likely for them to use our product. So I will just put 100% here. But for the suburb, it will take 58 minutes to the hospital, which means there's only 2 minutes left to administer our product, but I don't think it is realistic. So I will say it is unlikely for them to choose our product because our product is $2,000 more expensive than competitive drug. So I put a 0% here. So with that, I will just go back to the higher level of the framework. So the patient choose our product under the ambulance branch is all coming from the city, which is 80% of the population times 100%. So if we're gonna plug all the number in to calculate the patient population who call the ambulance, it will be 260K times 80%, which are the people receiving the service, times 60%, which is who can actually reach the hospital in the first 3 hours, multiplied by 80%, those people who live in the city that will choose our product. And then let me just do a quick calculation. It usually takes me like 1 minute to calculate those numbers. And then here I already list the result here. For the automatic trigger, the result is 52,000 people. And then for the ambulance service is around 100,000 people. So for the total number of patients getting treated, we're just gonna add those numbers together to 152,000 patients.
Okay, sounds good.
Then, so we finally solve or calculate the number of patients. So to calculate the revenue, we're just gonna use the unit price, which is the price per patient, multiplied by the number of patients, which is 8,000 multiplied by 152,000. And the final result is 1.2 billion per year. So that's my results of the revenue. Does this number make sense to you?
Yeah, it's correct.
Okay, Sounds good. Yeah, I think this number makes sense to me because it's on the order of magnitude I would expect. And the next step I would propose is to benchmark 3 things. First is our cost, because we want to look at the profitability eventually. So we have to make sure our cost is not very high so that we can be profitable or at least break even. And then the second thing, we can also look into the other product line in the client's company to compare or also to prioritize a resource within the company. If our product can make significantly much more profits than other product line, then we can probably focus more on this product and reduce the cost and even make more profit from it. And then the third thing I wanted to do is to benchmark to the competitor to see with a similar product, just like the competitor you mentioned in the last question, how's their profitability and what is their revenue? If there's like order of magnitude difference, then we might look into what is the reason behind. Yeah.
Okay, sounds good. All right, so let's pause here and then review the full structure and analysis here. So I just got another question. How about the time that doctors spend diagnosing the patient? It's no harm to ask. There are some risks that the doctors need to take time to diagnose the patients, or even there are some emergencies, maybe like the hospital don't have enough room for the patients, so the patients have to wait a little bit for the emergency rooms. So those are the potential risks that you can cover in your discussion, like saying that probably the targeted patients, it's smaller than you estimated because there might some risk, such as diagnosing takes time, the waiting takes time, or some other emergency takes time. So that's a very good point. Yeah, so bringing back to your interview performance. So firstly, I really like your framework. It's very structured. So I think in the framework, the most important thing is being structured, because for new casers, it's very easily for people to jump randomly to talk about what they think important. But if you don't follow a logical structure, like layer by layer, it's easy to get lost, and your interviewer, it's harder for interviewers to follow you. So make sure like when you list the structures, you are actually listed very structurally. And when you talk about your structures, you go layer by layer and you don't jump here and there. Okay. And the second is, many of you have probably noticed that our case went very smoothly. So this is the ideal case because we have known the case well already. So when you do the real interview, you might have some difficulties in the middle. For example, you might have difficulties segmenting the patients because you maybe you couldn't realize that the distance of the patients from the hospital may be the key. So you might have some difficult time to finding the right directions. But for these situations, make sure like you are hypothesis driven and you are following your hypothesis with a logical way. So even though like it takes time for you to get the right direction, it's still like there's no harm for you to explore other opportunities and possibilities. And it's your interviewer job to guide you back on track. But make sure like you're not lost or jumping here and there, right? And the third is, I really like what Amanda did in the case, is that she always trying to be active and lead, even though like in the McKinsey case, it's that the interviewer led case, but she is always trying to propose the next step for her analysis, like saying that after the analysis, she already started to propose next step. She wants to look at the cost and the other product and the potential competitors. She already burned that on the table, which is a very proactive way. So usually your interviewer likes your proactivity, and they like you to trying to lead the case. If it's in the right direction, it's perfect. But if it's not in the direction they wanted, they will guide you. And and also it's also a good way to show your thought process and your hypothesis driven process. Right. And the last thing I really like is that, again, like this case is a very math heavy case. This is probably the most math heavy case that I've ever like practiced on. Again, like getting the right number is important. It's already challenging, but it's even more challenging to show your thought process and how you're gonna calculate it to your interviewer without the draft paper and without any slides in the real interview. So make sure like you are comfortable doing that. Just say it orally and let your interviewer follow how you're gonna calculate it. And during that calculation session, make sure like check your interviewer's expression, facial expression. If he looks confused, that means he probably have lost. So make sure you stop and ask him whether he's with you. Right. And another thing I really like how Amanda did is that she always separate her numbers and her formula separately. So when she talk about formula, she always talk about the objects of all the information she needed. And after she showed the formula, the interviewer understand what she want to do. She plug in the numbers and set the formula again. And then she takes time to calculate it. So it's a good strategy to separate them instead of mix them together, because if you mix them together, it's easy to get your interviewer lost.
Yeah, I remember when I first got started, I always do those things together, but Sophie corrected me in this way. Yeah, I still remember that.
Yeah, I was corrected by someone else. Like it's very naturally to you do your mind calculation, like you just randomly murmuring like okay, so it's 3 times 5 times 8. Your interviewer doesn't like that. It's hard to follow. So what you want to do is actually, okay, I want to calculate in this way. It's A times B times C. Okay, so and then I got the numbers. So the number is blah times blah times blah. So let me take some time to calculate it. So the final answer is that. So it's much more clear for interviewer to follow.
Before that, we had some question in the chat. So for Miranda, is it relevant to ask about the manufacturing, like percent yield, if the company has the capacity to produce so many doses from the onset? Yeah, that's a really good point. Usually in the case interview, especially a McKinsey case, we will have 2 to 3 buckets, and you can put those insights in the third bucket, kind of like the risk or capacity, something like that. And you can talk about manufacturer, personnel, like if you have this expert on how to synthesize the drug. And also you can talk about the supply chain if you have the capacity of purchasing the raw material and also to distribute all your product to the hospital, something like that. Yeah, those are some really good qualitative insight that you can put into a framework.
Yeah, I think this is a very important point to make. You always want to keep the capacity in your mind, because some cases are designed for that. The capacity is default for some other cases. Yeah, that's a very good point.
Next one, do we always segment the patient first and calculate the profit for each segment? So that's just my personal way of doing this. But because I found in most of the cases, the interviewer would like you to put segmentation, because especially for those really broad estimation for like revenue of a really large market, it is usually segmented. For diseases, it could be like moderate or severe cases to like segment the patient. It's no harm to ask if there are any need to segment the population. You don't like always have to do the segment, but it's better to, yeah.
And quickly, the next question is good brainstorm questions. Given that our revenue is this $1.2 billion, how can you further increase the revenue?
Okay, thanks for a question. Let me take a minute to structure my thought. But I will just skip that 1 minute because we're running low on time.
We're running out of time.
Yeah, but typically we will take 1 minute even for a brainstorm to structure our thought. Okay, so I will just recycle my framework from the previous question. For revenue, we can look into 2 parts. First is the price per patient. The easiest thing to think about is if we can further increase the price, but that will also bring the risk that if we charge too much, then it will not be competitive in price because we are already expensive than a competitor. So we can also think about increase the number of the patient. And under that segment, I have some thoughts here. So first, the total number of patient, that's only the cases in US. But if we have capacity, we can consider like go inside other country and enter a different market by collaborating with another company or just do on our own. And also, if we look down into the patient who get treated, there's 2 factors here, and we can probably do better on both of them. So as we discussed, the patient can be treated in 3 hours only. So can we do like faster transportation? Like we noticed the automatic trigger is really effective in terms of bringing the patient. So can we have like collaboration with the provider to like ask them to prioritize the stroke patient to use the automatic trigger service so that more people can get there in in 3 hours. And also one thing we can think about is that can we put more R&D force to it and find a way to administer drug in the ambulance? Because we have a lot of professional facility in the ambulance. And if we can do that, it will definitely increase a lot on the patient population. And then the third thing to consider is the willingness of the patient or physician to choose our product. Beside of the current advantages, we could further improve the physician's experience. For example, to make it easier, like if you have to dilute the solution before, then we can just pack the diluted solution so the physician can save one step. Yeah, something like that.
Those are all good points. So one thing I would like to comment on is that for a brainstorm question, it's also important to have a structure. Like you probably, like after hearing the brainstorm question, you probably have one or two answers in an unstructured way. And then you talk about your answers that come out of your mind, and your interviewer will kept asking what else. And it's very hard for you to just come up with other answers. But if you go with a structured way, then you know like what kind of directions you have not explored, and then you can talk about the answers from that direction. Okay, so that is the end of the case right now. There's one more question here. So Anna said, in this case, if we don't talk about the competitor first, we have no idea to segment patients in one offer, and they are not. Yeah, that's a good point. So so I think for the drug case, usually the life science case, which is a market entry case, 90% of the time, I would say talking about the market, it's a must. And under the market, talking about the total market size and your competitor is a must. So I highly recommend everyone to list your market size and competitor as your first bucket of your framework. So we always want to start with the markets, so that you understand how to segment your patients later. So that is the end of the case. And Amanda will
demo case 环节到此结束。在下期视频里面，我们会分享一些我们在申请过程中和准备面试过程中的一些经验，以及分享一些对我们非常有帮助的资料。同时 Sophie 和我还会有一个 Q&A 环节 ，Sophie 的 Q&A 非常的精彩，请大家一定不要错过哟。
希望大家多多关注 Amanda 9点赞93点，这次一定哦。